So I want to give you a little bit of background on the device that I sent over to you a picture of. Um, the uh, the low-level laser stimulation devices, they are called, although that is not the technology being used with a laser. And so this is based on the work that was done by Dr. Schiffer, who is a professor of psychiatry in at Harvard, and he went ahead and used low light laser stimulation, similar to the manner in which I'm doing it, and found to have good results in depressed patients. It should be noticed that he has a pretty adverse sort of not an adversarial, but he has just a general sense of adversity towards anything that has to do with prescription medicine. So that should be noted at the top because there's obviously some level of bias that's there. But he went ahead and put together this protocol. I think it's basically on the Hamilton and Mars D, if I'm not mistaken. And he, saw in, I'd have to convey the actual study over to you, but there was a pretty substantial number of times where he saw an over 50% reduction as far as the symptoms were concerned. So from that, I went ahead and looked at the first analysis that I wanted to do was there really any difference as far as a laser versus an LED was concerned? And the only real difference is, once you generate that energy of photons, so whether it's the device that's being used is going to be a laser or is going to be an LED, they're photons. The difference is with the laser, obviously, you're going to get a stronger stream of photons that is more what's the word, that not calibrated but collimated, that is more collimated, and therefore you're going to get a higher density of photons in one particular area, whereas the LEDs are going to be more diffuse. But one should also consider the fact that there's going to be a lot of scattering just based upon the nature of bone and the way that the photons at the near IR enter into the to the physical body, especially at the skull interface, and also once it gets past the skull and into tissue in the brain. Now, there are those argue, and there's a whole group of argue, I think is Dr. Maurice is his name, who's out in Denver, and he'll argue that the LED never even reaches the brain. But that's very, very difficult to understand for two reasons for me. For me personally, I've already, experienced quite real symptoms or real symptomology as a result of the device. So I did not find it to be artifact whatsoever. In fact, I'll describe that a little bit more. But before doing so, what I wanted to say was that the other thing is that it's hard to understand logically because there's clinical instruments that are made based upon the use of LEDs that are looking at the difference in oxygenation at the hemoglobin. So, and those work. So they work for either fetuses or they're used in some cases in adults also. So I think that argument is a pretty much false argument. Now, in terms of his application, which is TBI, so the TBI, obviously you do need to get into deeper regions of the brain, so it makes more sense to be able, his contention is that unless you get up into high power lasers, that you're not going to be able to penetrate into the brain to the necessary degree that you need to, which is, I guess, at least 3 centimeters or something like that. So again, From my own personal experience, I found that to be not the case, to say that the LEDs did not at all penetrate into the brain, because there was definitely an effect. The most noted effect for me is now on two occasions is really imagery. In fact, the both the effect that happened at the time of the treatment, which was the imagery that was evoked in the brain, and not only that, but post the treatment, when I was downstairs and I went into our closet to get out a coat. So all of a sudden, my brain was wanting to put the context of the coats and kind of follow all the different times I had seen closets historically, in my mind, which very very rarely am I able to do that. So, and not to say that it was a complete success in being able to do that, but my brain wanted to be able to start doing that. So there was clearly an effect as far as the treatment was concerned, that I was able to notice. Okay, I just want to get into very briefly here. I'm going to keep this within 10 minutes, but I think it's informative. I think it's kind of important to understand some of the principles and concepts here. So Schiffer, what I believe he used was 300 milliamps in total. And what we did was we created two arrays of 9 LEDs on each side of these glasses. So what you have here is what was designed for prototypical purposes are these glasses here, that have the arrays of the LEDs inside, and they are attached to a sunscreen that goes over a regular pair of glasses. So it's those sunglasses, the clip-on sunglasses. And then they are all manually wired to the two circuit boards there, and they're through-hole LEDs, and they are 808 or 810 nanometers. And then you can see on the outside here, there's a single RCA phone jack, and that RCA phone jack then goes and connects with the driver module here, which I won't get into all the circuitry of the driver module. I think it's pretty irrelevant as far as these purposes are concerned, but it runs off of 5 volts, 300 milliwatts, and there's the RCA phone jack that connects it, switch, and the power cord, and then you got the circuit board inside. So and right now I'm doing it on a manual timer basis, just using my phone, but it can be upgraded to actually do it within the context of an app. But anyway, that's down the road if I choose to go that direction. That's basically it, I guess. So the question is if indeed we find sustained response as far as this is concerned, the next question is to develop a protocol and to be able to test these on patients and to be able to get some, and publish these results, and then to see a way of being able to use this on some wider scale to be able to be a benefit for other people. So I will cut it off here at 9 minutes. Thanks.